plan of care. The simplest definition of a nursing aim is it answers the question, what do we want to achieve? It is a statement of intent to either resolve or minimize the nursing problem. Nurses identify and set nursing aims every day when caring for patients and act on them with nursing interventions. Whether it's controlling pain level, helping improve their respiratory rate to normal range, or ensuring they remain fall-free in the future, they must implement interventions to reach their aim. For example, patient complains of pain. That is the nursing problem. Nurse gives an analgesia. That is the nursing intervention. Nurse reassesses pain and reassesses the patient, and they are pain-free. That is the aim achieved. In the OSCE, the process is formalized into a written care plan. After identifying the patient's priority nursing problem, you will have to set an aim which will minimize or resolve the nursing problem. The aim will be written as a statement of the desired outcome or change in the patient's condition. Writing nursing aims in the OSCE. A nursing care plan is a document for all healthcare staff and for the OSCE patient. It is a shared document that is to be referred to and written in by different staff members. Aims should be read and understood at a glance by all. Each member of the team must be able to clearly see what the aim is and be able to measure if it has been achieved. The aims must be specific, measurable to work, and must have several qualities. Aims describe what the nurse and patient hope to achieve. Measures the effectiveness of care. Determines whether a nursing problem has been resolved. Motivates the patient, family, and nursing staff. Provides direction for planning interventions. Gives everyone focus when using interventions. Provides a sense of achievement. To have all these qualities, aims need to be written in the SMART or SMART format: specific, measurable, achievable, realistic, time-oriented. Specific and measurable aims. Making nursing aims specific and measurable makes it easy for the whole nursing team, Sumira and her family, to see when the nursing aim has been achieved. Let us consider the nursing problem. Sumira is experiencing head pain 5110 due to head injury. Instead of a SMART aim, the following nursing aim is used. Sumira's pain will improve. The nursing aim has no measurable or specific words. This causes several problems to arise as each nurse and healthcare assistant looks at the aim. It poses the following questions. How much does Sumira's pain score have to improve by to achieve the aim? If Sumira's pain score goes down to 3 out of 10, is that enough? Or must it be 0 out of 10 to achieve the nursing aim? Does Sumira report on the pain score, or does the nurse observe Sumira and rate pain? Without specific and measurable words, this nursing aim does not meet OSCE standards, as it is not easy for the next nurse to follow. This aim is too vague and open to interpretation. However, this problem can be easily resolved by using the SMART approach to write the nursing aim. Using measurable and specific words as follows. Nursing aim. Sumira will rate her pain with a score of 3 out of 10 or less. The aim is a measurable specific pain score, and so that Sumira will be able to rate the pain score specifically less than 3 out of 10. This nursing aim now meets the exam standard, as it can be easily understood and followed, and it is now clear when the aim is achieved. Measurable and non-measurable words. Aims that is realistic and achievable. Now we know the steps to making a nursing aim specific and measurable. The next step is to understand what is needed to make a nursing aim realistic. Look at the nursing problem. Sumira is experiencing head pain of 5 out of 10 after sustaining a head injury. To resolve it completely, a nursing aim would say Sumira will have a pain score of 0 out of 10. However, a person-centered approach must consider the information gathered from the patient during the assessment station, then use skills to consider Sumira's data and find a nursing aim that is more realistic. In assessment, Sumira has a pain score of 5 out of 10. Sumira also has had significant trauma to her head. Ideally, Sumira would have a pain score of 0 out of 10. This nursing aim may not be realistic. Also, it must be achievable within the time frame of the OSCE planning station scenario re-evaluation time and date. Her pain is unlikely to be completely resolved at this time due to the trauma of Sumira's physical injury. Being realistic means choosing a nursing aim that will minimize rather than resolve the nursing problem. In reality, a nurse would talk to Sumira and her husband about a nursing aim for pain and manage her expectations. In the OSCE, this conversation is not possible, so the nurse demonstrates clinical knowledge and understanding of care planning by writing a realistic and achievable nursing aim, such as Sumira will rate her head pain at 3 out of 10 or less. Patient-centered care involves including a patient's family or significant carers in her plan of care. It reflects the holistic approach we strive to achieve in nursing. The aim should be individualized to your patient. Be written in a way that is easy to measure if aim has been achieved. Be easily understood by both Sumira and the other nurses following the care plan. Must be realistic. For example, we may want Sumira to be able to mobilize to go to the shops with a walking aid. But is this realistic at this moment? Using aims in your OSCE care plan creates a goal-oriented approach to guide nursing care decisions, easily measuring the success of the care plan. It makes sure that the nursing care you plan for Sumira is individual to her and her nursing needs. It identifies the aim of care and so focuses nursing care and the actions of the patient themselves. It makes it easy for Sumira to see her health improvements. Aims help and guide everyone and make it easier to plan and coordinate nursing interventions to achieve each aim. Agreed upon aims of their care and the interventions that will be used to achieve these aims with Sumira and her husband. Beneficial effects of setting goals to support health behavior change. Furthermore, it is advised that goals are specific, measurable, and formulated in terms of behavior change rather than in terms of health outcome. Stretcher et al. 1995, Bartholomew et al. 2011. Setting goals and identifying actions. They need to be set, both short-term and long-term. SMART goals should be identified, that is, those which are specific, measurable, achievable, realistic, and timely. Hamilton and Price 2013. These are all done in collaboration with the patient. For Sumira's nursing plan to work, the nurse Sumira and her family will take responsibility for performing interventions that will achieve the aims. Nursing aims are nursing goals. These aims help direct care and give both Sumira and the nursing staff looking after her a clear idea of what is expected or possible. The aim, first of all, has to be easily measurable. Setting aims for your OSCE patients. Although it's important to consider the patient's thoughts and feelings when planning care, these can't be readily observed or measured. Words to avoid when setting your patient's aim. Accept, know, appreciate, understand. Use words such as demonstrates, states, expresses, scores, rates. Self-care aims further involve Patrick and his family in his care. Patients and their family taking responsibility for their care plan. Self-care aims further involve Sumira and her family in her care. For the care plan, you write to have meaning. Sumira and her husband should feel they have ownership of the care plan. In real-life practice, the nurse planning care will talk to both Sumira and her next of kin together before writing the care plan. It is important to invite Sumira's husband into this conversation, as Sumira is confused and may struggle to answer for herself. You will get a better picture of Sumira's pre-hospital health status. It will become clear if she has any problems completing the activities of daily living and what her likes and preferences are. Roper's model places a great deal of emphasis on the role of the family, especially when the patient's family members take on the role of the patient's carer. In a real-life situation, the nurse would identify the nursing problems and then agree with Sumira and her husband on a nursing aim for each problem. For example, the nurse, Sumira and her husband could identify risk of falls as a nursing problem. They would then agree a nursing aim for this problem, such as Sumira will have no incidents of falls during her hospital stay. They may then talk about ways a fall could be prevented. The nurse can write a plan to achieve the same by planning nursing interventions. For example, refer Sumira to the falls prevention team. Sumira and her husband can also take responsibility by planning a self-care intervention, such as agrees to talk with the falls prevention coordinator. Working together, the nurse, Sumira and her next of kin share responsibility for achieving the nursing aim, and it is more likely to be achieved. Importantly, it also empowers and involves Sumira and her husband in her care. However, real-life care planning is very different from the OSCE. In the OSCE, it is just you who writes the care plan. It is unlikely you would have time and assessment to formulate a care plan with the patient. Identify urgent nursing problems, decide on nursing interventions to achieve the aims. You must decide on a few appropriate self-care interventions that Sumira and her family will do to achieve the nursing aim. This must be completed with all the patient's details and the completed care plans within 15 minutes.